Hi, I'm Dr. Promila Mehan, and in this video today, I would like to share with you the advantages and disadvantages of using a CPAP machine or an oral appliance to treat your sleep disorder. Now, you've gone for your sleep study, you've met with your sleep physician, and you have a diagnosis of a sleep disorder. Now you need to choose, are you going to use a CPAP machine or are you going to use an oral appliance? In 2015, the American Academy of Sleep Medicine created new guidelines specifically stating that patients, you, have the right to choose either an oral appliance or a CPAP machine to treat your sleep disorder. Both have their advantages and disadvantages. Now, the first question I always get asked is there any insurance coverage for an oral appliance? The Assisted Devices Program with OHIP will cover the majority of the cost of a CPAP machine. It does not provide any coverage for an oral appliance. However, many extended health benefit plans do provide some, and few of them actually cover all of the expenses of an oral appliance. So it will be up to you to have a conversation with your insurance carrier to see if you do have some coverage for an oral appliance. CPAP is an acronym, CPAP, Continuous Positive Airway Pressure. It's like having a very, very strong fan blowing air into your mouth and into your nose, forcing your airway open to force air into your lungs. An oral appliance, what this does is it advances your lower jaw, it stabilizes your jaw muscles and your airway muscles, and allows you to breathe naturally, to bring air naturally into your lungs. An oral appliance, it's custom fitted, so it's made to fit you. So they're comfortable and they fit extremely well. With the CPAP machine, they have a variety of masks, stock masks, meaning that they're prefabricated. There are many different shapes and sizes for these masks. For many people, getting a mask that fits them properly can be quite a task. In fact, one of the most common complaints of CPAP machines are ill-fitting masks, which create a lot of leakage of air that create a dry nose, a dry mouth. Some people even have nosebleeds due to all of the air that leaks around the mask. For an oral appliance, we don't have any of those problems. Maintenance. For an oral appliance, all you do in the morning is you rinse this with water. You could use a little bit of soap and water and clean it really well. And then you store it in a bath containing a solution that will disinfect it while it's not in use. For a CPAP machine, you can see there are a lot of parts to a CPAP machine. Maintenance can be quite cumbersome, keeping the hose clean, keeping the mask clean, keeping distilled water in here, and so much more. Quite a difference in the maintenance of the two different devices. The other thing with CPAP machine, it requires electricity. I have a lot of patients that love to travel to remote areas. They like to go camping, fishing, places where you don't have access to a plug outlet. For those patients, many of them actually even use a CPAP machine and love using this every night. But for their times when they travel, they've opted to get an oral appliance. So these oral appliances can be used in these remote areas where you don't have access to electricity. These oral appliances are also wonderful if you're someone who travels a lot. In an airplane, it's so easy to take this and pop it in your mouth and get a good night's sleep. You can't do that with a CPAP machine. For severe apneics, people who have the diagnosis of severe apnea, a CPAP machine is the treatment of choice, simply because we can increase the pressure to force air to keep that airway open as much as is necessary to keep the air coming into your body. For some people, what they have done is they find that the high pressures can be almost intolerable to them. For some of my patients, what we have done is we have made an oral appliance. It opens up their airway. It helps to keep the airway open, stabilizes the jaw, but more importantly, allows us to lower the pressure on the CPAP machine so that they have fewer side effects from the CPAP machine. Compliance is quite different between the two as well. Depending on which study you see, the compliance for a CPAP machine varies to between 20 to 50%. For an oral appliance, it can be from 70 to 90%. Using both is a wonderful option if you're severely apneic or if you like to travel. For other people, it really is important to choose one or the other. Which one would I choose? I would use an oral appliance. Traveling with something like this is so easy. You can put it into a container, store it in your pocket, store it into your purse. It's easy to use because it's made specifically for you. It's convenient. It works. It'll help you get the sleep that you need to recover from the previous day's activities and to help you wake up feeling alert and excited about your new day. Thank you for watching this video, and please subscribe to this channel if you would like to continue to learn more about oral appliance and sleep disorders. Have a great day.